were talking about craving medication, right? So how do we approach that? Do we need to meet a professional and assess our situation?
Yes,
What's the right?
yes. So, Sadish, this is a very, very important question. So, a a person, like I said, alcohol dependence is a medical problem. So, trying to treat that person on, at home or with our just counseling by itself, the person has alcohol dependence. If there is abuse, that means the person is using it once in a while, we may not need medication. But if the person is having alcohol dependence, then you need to let the person meet a psychiatrist first, not just the counselor. Meet the psychiatrist first because there is a lot of assessment that we will do. What do we assess? We assess the consumption of alcohol, and it's not just about the alcohol, right? If I'm going to treat somebody with an alcohol problem, I'm going to look at that person holistically. We'll start understanding the person's childhood history. We'll start understanding the parenting that the person has undergone. We understand the vulnerabilities and when the person started, the quantity that the person has started, the last time the person has started, what are the withdrawal symptoms that a person is experiencing. And all the persons with an alcohol dependence will have withdrawal symptoms. The first 2 to 3 weeks that we are treating is about taking care of that withdrawal, because withdrawal symptoms is the most important reason of why somebody goes back to drinking. I know that it's causing my family to break up. I know that I'm losing my job. I know I'm having a debt. But doctor, I cannot stop my tremors. I cannot stop my restlessness. I can't stop hearing voices. And I have that one glass of alcohol and all these symptoms are going away. So if we are able to assure the person that we'll take care of all these withdrawal symptoms. And once the withdrawal phase is over, the detoxification phase is over, there are a number of medications that we give. So two things work in anti-craving. One, like I told you in the beginning of my talk, that alcohol works on the reward pathway. So we help modulating the reward pathway with the help of medications. 75% or maybe 80% of patients who have suffering with alcohol dependence problem also have underlying depression or anxiety and other issues. So we treat that too so that the person doesn't go back. I treat the alcohol is over, but the underlying depression is still there. So we treat that too. So if you're looking at treatment for alcohol dependence, the only thing that you must do is take the person to a psychiatrist. And then once this whole process of medication is over, then we also connect them simultaneously to the AA. If we feel therapy is required, we do that. If you feel spiritual counseling is required, you do that. But all those things are branches and we work holistically together.
Correct. Okay. Thank you. Any other question? Please go ahead. Unmute and ask.
Yeah, can I have a short follow-up, please, on the same?
Yes, Satish.
Okay.
Okay. I was watching one of these TED Talks where a recovering alcoholic talks about this medication, one particular medication, which basically does a brain hack. So even if somebody places let's say, bottle of wine before them, they wouldn't process it like an alcoholic would process it, and they wouldn't basically even get the desire to drink it. Are there any medications like that available in the Indian market?
So that's what I said. The anti-craving medication will work that way, right? It's not going to give me the desire to consume alcohol. So that is the whole idea of anti-craving medications, and we have all the medications available in the Indian market.
Okay. So, sorry, last question. So can it be taken by somebody like me, but sorry for getting personal, but let's say I stop today. For a week, I'm okay. For a month, sometimes I'm okay. Earlier, for a year also, I was okay. But then I would relapse, and start drinking a bit
Yes.
heavily. So for a person like me, can I directly take the medication, or will I have to go through the entire counseling process?
You must. So if it is if your consumption has not been there in the last week and you're anticipating that you're going to kind of relapse again, then whether you want to take the withdrawal or you want to take the anti-craving medications, you must get yourself evaluated first, because like I told you, there are multiple factors which lead to that relapse. So once a psychiatrist evaluates you, then of course I can give you an anti-craving medication that will definitely help in this sporadic pattern which starts because of what you're describing to be something which we call as a binge drinking pattern. So that means a person is
Yep.
off alcohol for about 3 to 4 months, and suddenly there is a trigger. You start drinking, then you binge drink for about a week, then again you go off. So there are different patterns. So for all this, an evaluation is very, very important, whether we give the anti-craving or not. So and I'm so happy and grateful that you shared your experience here. So I really hope that you take the help because it will really change your life and the life of your family.
Thank you, doctor.
Right. Any other question? Please go ahead. Anyone? Yeah.
Dr. Sheryl, do you offer online consultations?
No.
Okay. No, she's saying, yeah. But there are some who do, or
Yes, I have
There are
one
many,
question.
there
Sir.
are many psychiatrists who do online consultation also.
Okay.
But I would recommend that if you are somebody who's struggling with alcohol dependence, an online consultation may not be the ideal thing to do. In whichever city you are, whichever town you are, there will be a mental health professional psychiatrist close by. Because, like I said, a psychiatrist evaluates a lot of things when you come with alcohol dependence. We will evaluate your liver function test. We will evaluate your nerves, the tremor. There's so many things that we would want to see in person, which gets missed when we are doing an online consultation. So, and like I said, there are plenty of mental health professionals available everywhere. So, if you really feel that, you need to take help with somebody, it should be an in-person consultation, at least for the alcohol dependence.
Ma'am, but my question is not with reference to alcohol alone. In general, do you provide online consultations?
No, I don't.
Would you consider offering online consultations? Because there are people who would require.
Yeah, I understand that, but unfortunately, because of my hospital schedule and timing, I do not offer online consultations. I'm really sorry for that.
That's
I
okay,
can
no.
connect with Dr. Abhijit and Pastor Abhijit and give numbers of other colleagues who do online consultation. So then maybe you can get in touch with him and he can share the details of other doctors who do that.
Right. Thank you.
Right. Okay. Any other question? Go ahead, please. Unmute and ask. Anyone?
I think
Put it on the chat.
somebody was going to ask.
Yeah, somebody was trying to speak, no?
Sorry.
Kadambari, okay. Anyone?
Yes, yes.
Yeah, go ahead. Little loudly.
Yes, one question is that, sir, I say in my niece.
Little loudly, please.
Yes, I say in my niece so many times here relapse centers, but again when he come out of that, he again start take alcoholing and also stealing so many things and sell that and buy alcohol bottles, so many bottles in her home, and it's a headache for that, and his family go away far from him, and the old mother is there, and she have no earning. So what to do now? What to that person? He's lost his all aptitude, all headache, and all things. Body is collapsed by that. So, is there the medicines is useful for him also?
Yeah, thank you, Kadambi जी. ये एकदम relevant question पूछा आपने. It's very very important कि ये समझना कि a lot of times ये बहुत सारे rehab homes में treatment नहीं देते हैं.
Correct.
Right? There is no treatment. So there are a lot of rehab homes and we have many rehab homes like that कि जहाँ patient को वो जबरदस्ती लेके जाते हैं, रख देते हैं. पहला 1 हफ्ता patient को बहुत सारा withdrawal symptoms होता है, दवाइयाँ नहीं देते हैं बिल्कुल. इधर उनको बांध के रखते हैं या उनको बोलते हैं योगा कर लो, ये कर लो. और 1 हफ्ते के बाद जब 1 या 2 हफ्ते के बाद जब withdrawal चला जाता है, फिर 1 महीना रखते हैं, उनसे एक्सरसाइज कर लेते हैं और वापस भेज देते हैं. तो जो रूट कॉज है प्रॉब्लम का वो सॉल्व ही नहीं किया है. सबसे इंपॉर्टेंट अल्कोहल विड्रॉल में टू अंडरस्टैंड कि प्रॉब्लम रूट कॉज क्या है. ये जो आपका बच्चा है जो बार बार नेव्यू जा रहा है दारू पीने में लिए, उसको क्या प्रॉब्लम है, अंडरलाइंग प्रॉब्लम, उसका मोटिवेशन. बिकॉज अगर आप जबरदस्ती किसी को ट्रीटमेंट के लिए लेके जाओगे और रिहैब में एडमिट करोगे और वहां ट्रीटमेंट नहीं होगा, तो ट्रीटमेंट नहीं होगा तो उसका क्रेविंग कम नहीं होने वाला है. और जैसे ही बाहर आ जाएगा, बहुत बार पेशेंट्स रहते हैं जो हमारे फैमिली लेके आते हैं हमारे पास कि रिहैब होम के निकलने के बाद पहला स्टॉप इज द वाइन शॉप।
करेक्ट।
3 महीना रिहैब में रुके हैं और पहला बार जाके दारू की दुकान से ही दारू लेके आ रहे हैं। तो जो रिहैब होम में एडमिट हो रहे हैं उसमें ट्रीटमेंट क्या चल रहा है वो ज्यादा जरूरी है, दवाइयां देना जरूरी है। ये जो बिहेवियर है उसको चेंज करने में दवाइयों का बहुत फर्क पड़ेगा।
करेक्ट। सो
तो अब हम क्या करें उसके लिए, आप कुछ बता सकते हैं? वो जो फोन नंबर है उसके ऊपर कॉल करके हम गाइडेंस ले सकते हैं?
आप कौन से सिटी में रहते हैं?
अच्छा,
आप कहाँ रहते हो कादम्बिनी जी?
मैं पुणे में रहती हूँ, मेरी बहन औरंगाबाद में रहती है। वो उधर अकेली है और उसको वो उसके बच्चों को, उसका ही बच्चा है तो वो संभालती है, क्योंकि वो ऐसे थ्रो अवे नहीं कर सकती और उसका खुदा के ऊपर बहुत भरोसा है। तो
कादम्बिनी जी
वो हम
आपने कभी उसने कभी कोई साइकियाट्रिस्ट को मिले थे औरंगाबाद में? तो कोई साइकियाट्रिस्ट औरंगाबाद में मिलोगे तो ज्यादा अच्छा रहेगा।
अच्छा, ठीक है।
उनको बोलना कि किसी और रिहैब में नहीं लेके जाए, पहले कोई साइकियाट्रिस्ट जो औरंगाबाद में है उनके
हाँ,
पास जाके दिखे।
ओके ओके ओके।
तो या डॉक्टर शेरिल क्या कह रहे हैं कि अभी तक उनका ढंग का ट्रीटमेंट शुरू ही नहीं हुआ है।
हाँ, नहीं
अभी
हुआ।
तक आप जो कर रहे हैं ना वो ऐसे ही आप हाथ पैर मार रहे थे। अभी उनको साइकियाट्रिस्ट के पास अब जब लेके जाओगे तभी उनका सही ट्रीटमेंट शुरू होगा।
हाँ, नहीं, वो अभी एक अनकॉन्शियस था, वो डेड हो गया था, कोमा में चला गया था। तो उसको पुणे में एक सचुन हॉस्पिटल में एडमिट किया था। तो डॉक्टर ने घोषित किया था कि वो मर गया है, मगर प्रेयर चालू थी, इसलिए वो 3 दिन के बाद वापस आ गया। 2-4 महीने, 6 महीने, बरस भर नहीं पिया। बरस भर के बाद इतना पीना चालू कर दिया कि बस के बस। तो क्या करने को
राइट।
समझ में नहीं आता।
नहीं आप अच्छे साइकियाट्रिस्ट के पास जाइए, हम
अच्छा,
आपको कनेक्ट करके देंगे। हमारा नंबर
ओके,
चैट में
अच्छा अच्छा
हम
अच्छा।
आपको जरूर कनेक्ट करके
प्लीज
देंगे।
प्लीज
ठीक है।
प्लीज प्लीज, वेरी वेरी
Yeah, if she connects with you, I can provide you numbers of
श्योर
people in Aurangabad.
श्योर
ओके
श्योर।
ओके ओके ओके
या
Yeah,
आपका
yeah.
नंबर आप चैट में डाल दीजिए। हाँ, कोई प्रॉब्लम नहीं। मेल। ओके
ओके।
Okay.
ओके। एनीबडी एल्स? यस, गो
Yes,
अहेड।
yes,
थैंक यू।
yeah. Okay, yeah, excuse me, ma'am. Good evening, Pastor. Good evening, madam. I would like to ask one question. Like, is there any Christian rehabilitation center? Because a family has facing alcoholism, and then we keep the person in a private rehabilitation center is very costly. And then, like, actually, we really need a Christian environment where they should
So
grow
there
in the
is
word of
uh,
God.
so there is Kripa Foundation run by Father Joe Pereira, which is a very good rehab center where they have a psychiatrist who comes, evaluate. There were a lot of in-depth program happening. I'm not very sure whether it's at Vasai or Virar, but if you Google Kripa Foundation, Father Joe Pereira has done a lot of work with alcohol addiction. So
Okay.
it's run by Father Joe Pereira and his entire team. So
Hmm.
Kripa Foundation is a Christian organization that I am aware of.
Okay, thank you. Thank you so much, ma'am. How about, are you aware in Delhi, is there any Christian rehab center in Delhi?
I'm sorry, I won't know about Delhi.
या
Hmm.
बट या if
This
you
is,
stay in touch with us, we'll get you connected. या
hmm.
गांव पे।
So
Yeah,
maybe
thank
if
you
you
so
could
much.
send these, if you can send these queries and then we can find out for you and
Sure.
get in touch.
Yeah,
Yeah,
yeah.
yeah.
But this is Kripa Foundation is in Vasai, you know?
Yes.
Yeah, yeah.
Right.
Thank you so much.
Yeah, I've just
Because,
put the link of Kripa Foundation on the
yes,
chat, so you could visit and collect the details. Anybody else?
so much,
Any,
Pastor.
yeah. Anyone else? Go ahead and ask your question. You can also put it on private chat directly to Dr. Sheryl. It will be considered anonymous. Yeah. Go ahead, please. Yeah.
Can we again watch this program?
Yeah, it is on YouTube. It is on YouTube.
Okay.
NMBF Coffee Chats is the name of our channel. I will post the link, yeah, in a few minutes. Thank you. Okay, anyone? Go ahead, please.
What is the full form of AA? I just want to
Alcohol
confirm.
Anonymous.
Okay, and is it free?
Yes.
Yes.
Okay, thank you.
So Alcoholics Anonymous is a very good group. I've personally taken a friend of mine there, and they are very good. Those people are actually ex-drunkards who come together and they encourage people who are struggling, and they are very committed. They can even come to your place, talk to the person, and befriend that person, and know. So they are highly committed because they have come out of that nightmare, and they really are very serious about. So in every location, if you Google Alcoholic Anonymous and type your location, you'll find a cell there. So do get in touch with them.
Alcohol Anonymous is an amazing program, and they have something which you call like a 12-step program, where they accept also the problem that, okay, I have had I'm an they always say I'm an alcoholic, right? And I'm recovering. Even after 35 years, will introduce yourself as an alcoholic, I'm still recovering. So there is a lot of acceptance by the community. A lot of you get a sponsor who talks to you constantly. So it's a very, very encouraging environment. And I think post-COVID, a lot of online Zoom Alcoholic Anonymous groups are also there. So sometimes people who can't go, they can attend online Zoom also.
Correct. Yeah. Any other question? Please go ahead and ask. This is a very good opportunity. It's a small group, so please don't hesitate. This will really help you. Yeah, please go ahead. Unmute and ask, or put it on the chat.
Ma'am, this question is you're only mentioning for alcohol, or the same principles apply for all kinds of addictions, like? Because
So
the reason.
Yes, so the same principle applies to all addictions.
So
of
this
abuse. Yeah.
So this is basically an outward some inner problem, right?
Yes.
Okay. Actually, what happened is I was in high altitude. High altitude is this Leh Ladakh area, and I had acidity, severe acidity, and tea was triggering acidity more. I'm addicted to tea. I can drink 40, 50 cups of tea like that. So and this tea was aggravating the acidity, and I was taking drugs to curb my acid. But what happened is, in a high altitude on its own also acidity is higher, and you feel very hazy because even if you are adapted, you feel little hazy. I am not able to control my tea only. I am continuously drinking. I am taking the medicine to control acidity. My whole hand shivering, body is woe. I'm whole
But
thing.
that's why, again, the same principle applies. Your consumption of tea with such a high content is because of the caffeine in that tea, which is causing some stimulant activity in your brain. So you probably are somebody who needs a stimulant all the time. And when the tea is providing that, so 1 cup of tea says compared to coffee, tea has lesser caffeine, but tea also has caffeine. So when you're taking 40 cups, that means your brain is requiring that extra stimulation for whatever reasons. So that is the right time to go and meet a psychiatrist and evaluate why that stimulation is needed. And then if you address that problem, then your tea consumption will automatically reduce.
Okay, thank you. Substituted with coffee. Coffee was expensive. Some places $120.
Okay.
So maybe we should get it evaluated.
Yeah. Okay. Anyone else? Any question? Yeah. So what happens is often we see that there is at least someone in the society who struggles with alcohol, and you can see the person falling down. You can see the stress in the family. How does one take the steps to help in terms of that particular family? Because then people have this fear of, what if they get upset that, why are you interfering and all that? So what would be the way to go about it
Of course, so like I said, a lot of times people are not even aware that this is a disease, right?
Correct.
So all of us, we think that this person is weak and he doesn't have the willpower. So even if you are going to have a conversation with the family and explain to the family first that this is not this this whole idea of the medical model of addiction, that this is why you're father or mother or your son, your relative is having this problem. So there is an awareness. You can get the family connected to the support group of A, which is for the family group. So they attend meetings and they're also aware, right? And then you can, if when the person is sober and a little bit more ready to have the conversation, start engaging with the person in that conversation about how the health is. Try to empathize with the person. Say, I understand what you're going to, understand your withdrawal symptoms. Maybe we can go and talk to somebody and get help. It's not, and please be ready that the person may agree, will come, take treatment, and then there is going to be a relapse few months down the line. We cannot give up hope and give up on this person. We have to start that process all over again and again till we reach a point where then it becomes a lifelong time of free from addiction.
Right. There is a question that has come on the private chat. I think you've already covered it, but let me just say, when do you actually say that a person is addicted? Is it when you are not able to control the urge and you go and drink? Is that the time when you actually determine that you are addicted?
So if you are feeling that, like I told you, the tolerance, if the same one peg of alcohol was not giving you the same and you need to increase the consumption that you're doing, or if you don't drink, you experience uneasiness. Or the third thing is that, okay, you're constantly engaging with the idea of when do I get my next fix, and yes, it is a problem. So tolerance, withdrawal. If you look at the cage question, like I told you, the cage, are you trying to cut down? Are you getting annoyed or angry when somebody is talking to you about your alcohol consumption? Are you feeling guilty? The G is a guilty. And the E is, do you feel in the morning you want to get up and have a drink? Then it's a problem.
Right. Okay, any other question? Please go ahead.
Ma'am, can you teach us how to counseling with them so I can, I am going there and tell them that this is the rehab, this is good, means good center is this, and मैं उनके पास जाऊंगी, मेरे को अच्छा लगेगा, क्योंकि मैं पहले बार तो ऐसे लोगों के साथ मिलती थी, फैमिली के साथ, और जो दारू पीते थे उनको बहुत पिटती थी और पुलिस के पास लेके जाती थी, कुछ फायदा नहीं होता था। मगर अभी तो मेरे को ये मालूम पड़ा तो मैं जरूर जाऊंगी, मगर मैं कैसे काउंसलिंग करूं वो तो मेरे को नहीं समझ।
आपको केदारनाथ जी पहले ना उसको समझाना है कि हम तुम्हारे खिलाफ नहीं, हम तुम्हारे साथ है। ये आपको समझ, उसको डांटने से, बोलने की तुम इतना गलत कर रहे हो, तुमको समझ में नहीं आ रहा कि तुम क्या कर रहे हो, अगर आप उसको हर चीज में उसकी गलती या उसका चूक दिखाओगे तो वो नहीं चेंज होने वाला है। अगर आप उसको सहानुभूति से बताओगे कि हाँ, तुम्हारा जो दर्द है, तुम्हारी ये जो तकलीफ है कि तुम नहीं रोक पा रहे हो, ये मैं समझ रही हूँ और मैं इसलिए तुम्हारे लिए मदद के लिए आई हूँ, हम मिलके डॉक्टर के पास जाएंगे और तुमको कोई भी प्रॉब्लम होगा, हम ऊपर नीचे होगा, हम तुम्हारे साथ है।
Okay.
Yeah, any other question? Anyone else? Please go ahead and ask. Yeah.
I have one question.
Yes.
We saw that there is 12 to 13% alcohol in a wine. So is it the same wine we see in the Bible during Jesus' time?
No. Let's.
And this is a very important question, Pastor, because a lot of times people have this excuse of saying, oh, Jesus turned water into wine, so that is why I can drink wine.
Yeah.
But Jesus turned water into wine, I don't think he drank. Maybe that time it was culturally a part of, if you look at it, and as a cultural point of view, maybe there were vineyards there and grapes there, and how we have apple juice or we have, orange juice and pineapple juice. Probably, I don't know the biblical content. It could be that it could just be grape juice called wine. But just because Jesus turned water into wine is not giving us an excuse to have the glass of wine.
Right. Yeah.
May I just give a quick 30-second response to that?
Yeah, go ahead.
Okay, the one who raised that question about water to wine, you need to understand that the Bible uses Aramaic and Greek, Aramaic in the Old Testament and Greek in the New Testament. These languages have different words for the different kinds of wine. When that was translated into English, the English language has a very limited vocabulary in that it has many words for the same thing, but not different words meaning different things. So almost all these words have been converted into wine alone. But in reality, when you read the actual text, there are different words with reference to the concentration of alcohol in the drinks. So in most cases where the Bible talks about wine, it is not the alcoholic beverage. It is basically fermented wine with less degrees of concentration. Okay, that's about it.
Right. Thank you. But speaking of which, Dr. Sheryl, people say beer is not alcohol, beer is okay. So any comment on that? Will that be also a place
No,
of
because one small pint, 350 ml of beer contains 5 to 7% of
Okay,
alcohol.
correct,
So it's
correct.
just that you just consume a pitcher of beer, that's as equivalent as anything else.
Right, right, right. Okay. Any other question, friends? Please go ahead and ask. Yeah. So I was talking to a young person, and the person is unable to. He's struggling with his father being an alcoholic, and then there is a always every now and then there's a fight at home with the mother. So this youngster feels very helpless because the father is very stubborn, won't listen. And how do you help a person who just doesn't want to listen, who's stubborn and proud? He says, I work, I have the right to come and drink, and every evening there's a fight in the house. What do you do in these circumstances?
Like I said, right, you have to get engaged with that person when the person is doing okay to understand and make him comprehend his problem. He's not an alcoholic. This is, it's not an adjective actually. It is somebody who's suffering from alcohol dependence. So he's
Right.
suffering himself. Now, like you correctly said, sometimes we really cannot bring about the change because unless there is a motivation to bring about change, the person will not change. So we then engage with the family with a concept known as harm reduction. That means you have to learn to let go that this person, this individual, no matter how much I love, is not changing, and this is this person's life trajectory. We stop engaging about this and we move back and we kind of reduce our interaction, which is causing us harm. So
Correct.
then we have to look at ways of how do we become more independent? Can we move out? So many
Right.
other aspects, but thinking about the concept as harm reduction. I'm putting in a fence around me, or I'm wearing a mask so COVID doesn't attack me. In the same way, I set in that harm reduction strategies where the person who's not ready to change is not going to impact me so much.
Oh, that's very important because I think families feel very guilty and they get sucked down to the bottom along with this person. So if a person after some time is unwilling to change, listen, take help, so you better protect yourself instead of trying to, be able to get ahead. Yeah. Yes, Reverend Samuel, you want to say something?
Yeah, madam, it is very good that inputs that you gave today regarding that alcohol, and that in your first topic in the psychiatric substance dependence. So that the one of that word that spoiled the sub title, it spoiled the relationships with the related many these things. So as per that in the Holy Scripture, that Proverbs 31, 4 and 5, it is not for kings. It is not for kings to drink wine, nor for princes strong drink. And the words 5, let them drink and forget the law, and pervert the judgment of any of the afflicted. So this is happening in all that leaders meeting and other some these things, societies, everything. It is spoiled the justice also. They can't able to speak the justice, reveal the justice, because that they will forget the original their sins.
Yeah.
But the same way that Abhijit and other reverends that you can clear the doubts, or even though if I am a priest, the words that the Proverbs words chapter 31 verse 6, what it says, give
Yeah.
strong drink unto him that is ready to perish,
Yeah.
and
Reverend, we
wine
have
unto those that be of heavy hearts.
Yeah, definitely. We are not getting into scripture here because this is not a Christian forum. This is today this is an open meeting for everybody. So
Anyway,
let's
that is
get.
see, that is as per the Christian view, if we can say
No.
that we can give any explanations.
Yeah. Fine. Let people ask their problems that they're struggling with. Yeah, we'll get to the other part later. Yeah.
No,
Anyone?
that the leader said that he gave the explanation, the
Right.
wine.
Okay. I got it. Thank you. Okay. Anybody else? Go ahead and ask your question. Otherwise, we'll close the meeting soon. Yeah. You can put it on the chat if you've been wanting. If you're hesitant to ask, then put it on the chat directly to Dr. Sheryl or to me, and it will be considered anonymous. Yeah. Anyone? Yeah. So one of the things, Dr. Sheryl, is also when people go through financial crisis or when they go through a divorce, then many turn to drinking also. There are also women who turn to drinking. So what is the role the community around can play in such times, especially when we are having a false sense of privacy and which we try to hold on to. So
Correct, right?
what?
So like a vulnerable, you have to understand like an individual and his vulnerability. So that we're talking about, okay, a person is coming to you with alcohol problems, abuse, dependence, whatever, right? That is why we talk about evaluating the stressors and the triggers. By just taking care of the alcohol and not taking care of the stressors and the triggers is difficult. Now, if the stressor and trigger is a financial difficulties, we will have to help that person in some way and equip that person some way, and that's probably the role where the society will come in, right? That you can't preach to somebody on an empty stomach. You'll have to
Yes,
first feed that person and then preach to him. In the same way, if you don't help him as a community in giving him a job or trying to take care of his groceries or trying to do something so that you're easing out his burden, that will help him engage more in treatment and search for a job. So those factors, definitely the vulnerabilities we as society will have to take care of.
Right. Yeah. Thank you. Anyone else before we close? Please go ahead. So there is always someone who says, Pastor, I was about to speak and you close the meeting. That's how, yeah. But anyway, thank you so much. This was great. Personally, I have also learned so much, Dr. Sheryl. I think one big takeaway for me is to not see that alcoholics are basically to be people who are shamed, because that's what we do. We ridicule them, we shame them, and I know there are people also in our society and all, and we have seen them as a community, as a church also, as these are useless people. But I think this has really dawned upon me personally that this is a sickness and we need to give them correct medication. Also, I think I want to say also, Dr. Sheryl, is that you really brought out the truth about these rehab homes, because so many people are desperate and they just put their loved ones in rehab homes and where they don't even get any treatment. So I think I've seen 3 brothers in one family next door die one after the other through alcohol addiction, and I think at least 1 or 2 of them were taken to rehab homes. So there was no difference. So it's just such a sad case of ignorance also, along with this suffering that's going on. So I want to encourage all our friends here today to be lights to be channels of light in this darkness wherever people are, and give them this understanding that we have learned today. Yeah.
Just to, I just,
Yeah.
something just struck me when you were talking. I just wanted to say that once a person is having a problem, right,
Yeah.
then of course the journey is difficult to treat and we try our best. So also as a society, what we can do is try to first prevent. That is why the government increased the actual permissible age of drinking alcohol to 21, right? And when we talk to young adults, they say, so we can vote at 18, I can only drink at 21. Why? Right? Because your brain is only developed by the time you're 21, 20 to take rational decisions. So as a community, can I avoid displaying alcohol in my house? Can I avoid
Right.
drinking in front of my young children? Can
Yeah.
I avoid at every party that I will, can I make a decision? I'm not going to serve alcohol at every party that I'm having. I'm not going to serve alcohol at the wedding. Or can I kind of decide that, okay, maybe maybe you're a social drinker, maybe you have once in 6 months. Can I not do it when my young, impressionable children are around?
Yes.
Can I
Yes.
talk to my children about the problems that alcohol can cause? Right? Can I be mindful that if I'm having 11th or 12th graders at home for a party, or my child is going for a party to a house where there are 11th and 12th graders, am I asking this question to the parents, are you going to be there? Is alcohol going to be served? Because it's very, very common to see 11th and 12th graders go to parties where parents are
Yes.
also there and alcohol is served.
Right.
So if
right.
you're able to also be a little mindful about the beginning, our attitude
Yes.
and the experimentation stage, we can save a lot of people from going into a point where they become dependent and then the other issues
Yeah.
start.
And I think what I'm understanding is that it's really hypocritical as a parent for you to drink and expect not your kids to drink, right?
Absolutely.
That's just not going to happen. So we have to be very, very responsible. Yeah. So anyway, I think we'll close with that because we waited enough. Thank you so much, Dr. Sheryl. God bless you. We're so
Thank you. It was my pleasure.
yeah, encouraged and happy to participate in this. This was very, very enriching. And we hope and pray that this impulse, the stimulus that has come, we can carry it forward and help people around us. Thank you so much. Thank you so much.
Thank you, everybody. Good night and God bless.
Good night. God bless everyone. Bye.